Let's see about benign migratory glossitis or geographic tongue. So benign migratory glossitis. So migratory. It's this term tells the changing pattern. And geographic tongue, let's see and why it is called as geographic tongue. So this benign migratory glossitis is a psoriasiform mucositis on the dorsum of the tongue. Psoriasiform mucositis of the dorsum of the tongue. It is constantly changing pattern of serpiginous white lines surrounding areas of smooth depapillated mucosa. So there is a serpiginous white line and it is surrounded by a smooth depapillated mucosa. And the changing appearance has to let some, it called wandering rash of the tongue. And also it reminded of continental outlines on the globe. That's why it called as geographic tongue. So this picture showing the geographic tongue that affecting on the dorsum surface of the tongue, showing that there is serpiginous white lines and it is surrounded by a depapillated mucosa. Depapillated area, it is very smooth. And the etiology is unknown. So it is more prominent during conditions of the psychological stress. And also in if the persons having a psoriasis of the skin, there is a 10% increased frequency they have the geographic tongue, and 1 to 2 of the population are affected approximately. So the exact etiology is unknown in geographic tongue. Next, moving on to histological features. All of the microscopic features of psoriasis are present, but we have to take biopsy taken from the prominent serpiginous line at the periphery of a depapillated patch. So we have to take the biopsy. There is a thickened layer of keratin is infiltrated with neutrophils, and also lower portions of the epithelium to a lesser extent. So here there is a inflammatory cells are produce small micro abscesses. These small micro abscesses called Monro's abscess. It is very important. Monro's abscess are present in the geographic tongue, where it present in the keratin and spinous layers. And there is a Rete ridges are typically thin and considerably elongated Rete ridges, and with only a thin layer of epithelium overlaying connective tissue papilla. So if these retipex are not elongated, we would consider this condition as a Reiter syndrome. If it is the Rete ridges are elongated, it is geographic tongue. It is not elongated, it is considered as Reiter syndrome. And there is a chronic inflammatory cells within the stroma, and silver or PAS staining will often demonstrate Candida hyphae or spores in the superficial layer of the epithelium. And there is no liquefactive degeneration of the basal cells. As in if it is liquid reactions, there is a liquefactive degeneration, but here there is no degeneration. So this picture showing the histopathological feature of geographic tongue. There is a first one is in the pink color layer is parakeratin, and there is in the left side there is a small round. It is a Monro's abscess, and the elongated Rete ridges are present, and there is a red color dot are present in somewhere. It is a vascular ectasia. Next, moving on to treatment. Here no treatment is usually necessary for benign migratory glossitis and stomatitis. If there is any symptoms, we can treat it with topical prednisolone and a topical or systemic antifungal medication. Topical prednisolone and topical systemic antifungal medication. So occasional symptomatic cases are reported tetracyclines also.